Question 1. A 65-year-old male presents for his annual physical examination. During the encounter, the physician performs a comprehensive history, comprehensive examination, and medical decision-making of low complexity. The patient has no new problems addressed. Which E/M code should be reported? I. 99,203. B. 99,213. C. 99,387. D. 99,397. Answer D. 99,397. This question tests your understanding of preventive medicine E/M codes versus established patient office visit codes. The keywords annual physical examination and no new problems addressed are crucial clues, indicating that this is a routine preventive service, not a problem-oriented visit. For an established patient age 65, the correct code for a periodic preventive medicine reevaluation and management is 99,397. Codes 99203 and 99213 are for problem-oriented office visits, and 99387 is for a new patient preventive visit. Always remember to differentiate between preventive and problem-oriented visits, as they use distinct sets of E/M codes. Question 2. A patient with a history of recurrent urinary tract infections, UTIs, presents to the emergency department with dysuria, frequency, and suprapubic pain. Urinalysis confirms a UTI. The physician orders intravenous antibiotics and admits the patient for further observation. What is the principal diagnosis for this inpatient admission? I. R30-0 dysuria. B. N39-0 urinary tract infection, site not specified. D. C. N39-0 B95-4 urinary tract infection, Escherichia coli as cause. D. N39-0 Z87 440 urinary tract infection, personal history of. Answer B. N39-0 urinary tract infection, site not specified. D. This question assesses your ability to identify the principal diagnosis for an inpatient admission based on the Uniform Hospital Discharge Dataset (UHDS) definition. The keywords principal diagnosis and the presenting symptoms along with the confirmed UTI point to the condition chiefly responsible for the admission. The UTI is the definitive diagnosis explaining why the patient required admission and for antibiotics, not merely the symptoms or history. Although a specific organism might be identified later, N39-0 is appropriate as the principal diagnosis if the organism isn't specified at the time of admission or if the physician only documents a general UTI. Remember, the principal diagnosis is the condition established after study to be chiefly responsible for occasioning the patient's admission to the hospital. Question 3. What is the correct CPT code for a flexible diagnostic esophagoscopy? I. 43,200. B. 43,235. C. 43,245. D. 43,259. Answer I. 43,200. This question tests your knowledge of CPT codes for endoscopic procedures of the esophagus. The keywords flexible diagnostic esophagoscopy specifically indicate a procedure limited to the esophagus for diagnostic purposes, without any additional interventions. CPT code 43200 is defined as esophagoscopy, flexible, transoral, diagnostic, including collection of specimens by brushing or washing when performed. The other codes listed are for esophagogastroduodenoscopy ID or more complex procedures involving the stomach or duodenum. It's vital to choose the code that precisely matches the anatomical site and the extent of the procedure performed. Question 4. A patient undergoes a complete ultrasound examination of the abdomen. The findings include a normal liver, gallbladder, pancreas, spleen, and kidneys. What is the appropriate CPT code for the service? I. 76,700. B. 76,705. C. 76,770. D. 76,775. Answer: I. 76,700. This question evaluates your understanding of CPT codes for abdominal ultrasound examinations. The keyword complete ultrasound examination of the abdomen signifies that all major organs within the abdomen were visualized and documented. CPT code 76700 describes an ultrasound abdomen complete, which includes images of the liver, gallbladder, common bile duct, pancreas, spleen, kidneys, upper abdominal aorta, and inferior vena cava. Codes 76705 and 76770 are for limited or retroperitoneal ultrasounds, respectively. Always ensure the documentation supports a complete study, not just a limited view of a few organs, to report the complete code. Question 5. A 45-year-old patient is diagnosed with type 2 diabetes mellitus with diabetic neuropathy. What ICD-10 CM code S would be assigned? I. E1140, B. E119, G99, 0, C. E1142, D. E1149. Answer: C. E1142. This question tests your ability to use combination codes in ICD-10 CM for diabetes and its associated complications. The phrase type 2 diabetes mellitus with diabetic neuropathy clearly indicates that the neuropathy is a direct complication of the diabetes. According to ICD-10 CM guidelines, when diabetes is associated with a complication, a single combination code that includes both the diabetes type and the complication should be used if available. E1142 specifically represents type 2 diabetes mellitus with diabetic polyneuropathy. Using separate codes, like E11, 9 and G99, 0, would be incorrect when a combination code exists. Always look for specific combination codes first when documenting diabetes with complications. Question 6. Which of the following describes the proper use of CPT modifier 25? I. It indicates a significant, separately identifiable E/M service was performed on the same day as a minor surgical procedure. B. It indicates a staged or related procedure or service by the same physician during the postoperative period. C. It indicates an unplanned return to the operating room for a related procedure during the postoperative period. D. It indicates a professional component of a diagnostic test performed by the physician. Answer: I. It indicates a significant, separately identifiable E/M service was performed on the same day as a minor surgical procedure. This question assesses your knowledge of CPT modifiers, specifically modifier 25. The core concept of modifier 25 is to identify an evaluation and management E/M service that is distinct and significant enough to be reported separately when performed on the same day as a minor procedure. This means the E/M service went beyond the typical pre-procedure or post-procedure work included in the global package of the minor procedure. For example, if a patient comes in for a routine checkup E/M and during that visit, a new, unrelated skin lesion is found and immediately biopsied, minor procedure, modifier 25 would be appended to the E/M code. Remember, modifier 25 is only for E/M services performed with minor procedures, not for other procedural modifiers. Question 7. A patient presents for a diagnostic colonoscopy. During the procedure, the physician identifies 2 polyps in the descending colon and removes them using a hot biopsy forceps technique. What CPT code F should be reported? I. 45,378. B. 45,384. C. 45378, 45,384. D. 45,385. Answer: B. 45,384. This question tests your application of CPT coding guidelines for colonoscopy with polyp removal. The critical information is that polyps were removed during a diagnostic colonoscopy using hot biopsy forceps. CPT guidelines state that when a diagnostic endoscopy becomes therapeutic, only the therapeutic code should be reported. Code 45384 specifically describes a colonoscopy with polypectomy, hot biopsy forceps, or bipolar cautery. Since the polyps were removed, the diagnostic code 45378 is bundled into the therapeutic procedure. Therefore, you only report the code for the most extensive procedure performed. Question 8. A patient is prescribed a new medication, Advair HFA, for asthma. The coder needs to locate the HCPCS Level 2 code for this inhaler. Which HCPCS Level 2 category would most likely contain this code? I. J codes. B. A codes. C. K codes. D. E codes. Answer: I. J codes. This question tests your familiarity with the organization of HCPCS Level 2 codes, particularly for injectable and inhalant drugs. The keyword Advair HFA, an inhalant medication, is a strong clue. J codes, J0100, J9999, are primarily used to report drugs administered by methods other than oral ingestion, such as injections, chemotherapy drugs, and certain inhalation solutions. A codes are for transportation and supplies, K codes are temporary codes for DME, and E codes are for durable medical equipment, DME. Knowing the general categories of HCPCS Level 2 codes helps you quickly navigate the code set to find the correct service or supply. Question 9. Which of the following is the most important component when selecting an E/M code based on medical decision-making, MDM, for an office visit? I. History. B. Examination. C. Number of diagnoses or management options. D. Time spent with the patient. Answer: C. Number of diagnoses or management options. This question focuses on the key elements of medical decision-making, MDM, which is a critical factor in E/M code selection. The MDM component, as outlined in the E/M guidelines, assesses the complexity of the physician's thought process. It is determined by three key elements: the number and complexity of problems addressed, the amount and/or complexity of data to be reviewed and analyzed, and the risk of complications and/or morbidity or mortality of patient management. Therefore, number of diagnoses or management options directly reflects the complexity of the problems addressed and the management decisions made by the physician. While history and examination are part of the overall E/M service, under the 2021 E/M guidelines for office visits, MDM, or time, is the sole determining factor for code selection, not history or exam elements. Question 10. A patient undergoes a bilateral screening mammography. What CPT code F should be reported? I. 77,065. B. 77,066. C. 77,067. D. 77067, 77,067 to 50. Answer: C. 77,067. This question tests your knowledge of CPT codes for mammography, specifically distinguishing between screening and diagnostic types, and the appropriate coding for bilateral procedures. The keywords bilateral screening mammography are crucial. Code 77067 is specifically defined as screening mammography, bilateral, two-view study of each breast, including computer-aided detection when performed. This code inherently includes the bilateral aspect and is the single code used for a complete screening mammogram of both breasts. Codes 77065 and 77066 are for diagnostic mammography. Always select the code that most accurately describes the service performed, paying close attention to whether it is a screening or diagnostic study, and if it's unilateral or bilateral. Question 11. Which term describes a tumor that is non-cancerous and does not spread to other parts of the body? I. Malignant. B. Metastasizing. C. Benign. D. Carcinoma in situ. Answer: C. Benign. This question assesses your basic medical terminology, specifically related to oncology. The key phrases non-cancerous and does not spread to other parts of the body are the defining characteristics of a benign tumor. In contrast, malignant tumors are cancerous and can spread, metastasize. Metastasizing describes the process of cancer spreading. Carcinoma in situ refers to a localized, non-invasive form of cancer that hasn't spread beyond its original site, but it's still considered a cancerous condition. Understanding these fundamental terms is essential for accurate diagnosis coding. Question 12. A patient is seen for a follow-up appointment for established hypertension. The physician documents hypertension remains stable, continue current medications. Which ICD-10 CM code should be assigned? I10. B. I10 C79 899. C. I10 C79 899. Z91 130. D. Z0000. Answer I10. This question tests your understanding of coding chronic conditions managed long-term. The keyword established hypertension indicates an ongoing condition and remains stable. Continue current medications confirms that the hypertension is the reason for the encounter's medical decision-making. Code I10, essential primary hypertension, is the correct code for the diagnosis. It is generally not appropriate to add codes for long-term current drug therapy, Z79 899, unless explicitly instructed by a guideline, or for personal history codes when the condition itself is still active and being treated. Always code the confirmed active diagnosis unless otherwise specified by specific guidelines for chronic conditions. Question 13. A patient presents with acute abdominal pain, and the physician orders a limited ultrasound of the right upper quadrant to evaluate the gallbladder. What CPT code should be reported? I. 76,700. B. 76,705. C. 76,770. D. 76,775. Answer B. 76,705. This question tests your ability to differentiate between complete and limited ultrasound examinations. The keywords limited ultrasound and right upper quadrant to evaluate the gallbladder clearly indicate that the scan was focused on a specific area or organ, not the entire abdomen. CPT code 76705 describes an ultrasound, abdomen, limited, e.g., gallbladder, liver, spleen, kidneys, any one or more organs, or quadrant T. In contrast, 76700 is for a complete abdominal ultrasound. It's crucial to select codes that precisely reflect the extent of the diagnostic imaging performed. Question 14. Which of the following statements about CPT modifier 59 is true? I. It is used to report a significant, separately identifiable E/M service on the same day as a procedure. B. It indicates a distinct procedural service. C. It is used to report multiple procedures performed during the same operative session. D. It indicates a professional component of a diagnostic procedure. Answer B. It indicates a distinct procedural service. This question assesses your understanding of CPT modifier 59, which is crucial for preventing incorrect bundling of services. Modifier 59 signifies that a procedure or service was distinct or independent from other non-E/M services performed on the same day. This distinctness can be due to a different anatomical site, a separate incision, a different session, or an unusual circumstance. It's important not to confuse it with modifier 25 for E/M services or other modifiers related to multiple procedures or professional components. Always check NCCI edits first to see if a modifier is even appropriate before appending modifier 59, as it should be used only when no other, more specific modifier is available. Question 15. A patient undergoes an excisional biopsy of a skin lesion on the face, measuring 1 to 5 cm. The pathology report confirms it is a benign lesion. What CPT code should be reported? I. 11,102. B. 11,402. C. 11,442. D. 11,642. Answer C. 11,442. This question tests your knowledge of CPT coding for excisional biopsy of skin lesions, emphasizing the lesion type and anatomical location. The keywords excisional biopsy, skin lesion, face, and benign lesion are all essential for accurate code selection. CPT codes 11400, 11471 are for the excision of benign lesions. Specifically, 11442 is for the excision, benign lesion, face, ears, eyelids, nose, lips, mucous membrane. Lesion diameter 1 to 20 cm. Code 11102 is for an incisional biopsy, and 11642 is for a malignant lesion excision on the face. Always ensure you consider the type of lesion, benign/malignant, anatomical site, and lesion diameter when coding excisions. Question 16. What is the primary purpose of the National Correct Coding Initiative, NCCI, edits? I. To ensure appropriate reimbursement for services provided by different specialties. B. To prevent improper coding and unbundling of services. C. To determine medical necessity for all services. D. To establish fee schedules for Medicare and Medicaid. Answer B. To prevent improper coding and unbundling of services. This question examines your understanding of the National Correct Coding Initiative, NCCI, and its fundamental role in medical coding compliance. The core purpose of NCCI edits is to promote correct coding methodologies and prevent inappropriate payment for services that should not be billed together. This primarily addresses unbundling, which is reporting multiple codes for a service when a single, more comprehensive code would suffice or when one procedure is an integral component of another. NCCI edits help ensure that healthcare providers use codes accurately, thus preventing billing for services that are inherently part of a larger procedure or that are mutually exclusive. Question 17. A patient with a history of heart failure, CHF, is admitted to the hospital with acute exacerbation of heart failure. The physician documents acute on chronic systolic congestive heart failure. What is the correct ICD-10 CM code? I-5020. B. I-5022. C. I-5032. D. I-59. Answer B. I-5022. This question tests your ability to select specific ICD-10 CM codes for heart failure, paying close attention to acuity and type. The keywords acute exacerbation, acute on chronic, and systolic congestive heart failure are critical for precise code assignment. Code I-5022, acute on chronic systolic, congestive, heart failure, perfectly captures all these elements. I-5020 is for unspecified systolic heart failure, and I-5032 is for acute on chronic diastolic heart failure. Always read the documentation carefully to identify if the heart failure is acute, chronic, acute on chronic, and whether it's systolic, diastolic, or combined. Question 18. A physician performs an initial inpatient hospital visit for a patient admitted for pneumonia. The visit includes a comprehensive history, comprehensive examination, and medical decision-making of high complexity. What is the appropriate CPT code? I. 99205. B. 99221. C. 99223. D. 99233. Answer C. 99,223. This question assesses your knowledge of CPT codes for initial inpatient hospital E/M services. The key phrases initial inpatient hospital visit and the level of service, comprehensive history, comprehensive examination, and medical decision-making of high complexity point directly to the correct code. CPT code 99223 represents an initial hospital inpatient or observation care visit of high complexity. Codes 99205 is for new patient office visit, while 99221 is for a lower complexity initial inpatient visit, and 99233 is for a subsequent inpatient visit. It's crucial to identify if it's an initial or subsequent visit and then match the complexity level documented. Question 19. A patient is referred for a complete transthoracic echocardiogram with spectral Doppler and color flow Doppler. What CPT code should be reported? I. 93,303. B. 93,306. C. 93,307. D. 93,308. Answer B. 93,306. This question tests your knowledge of CPT codes for echocardiography services. The keywords complete transthoracic echocardiogram, along with spectral Doppler and color flow Doppler, indicate a comprehensive study. CPT code 93306 specifically describes echocardiography, transthoracic, real-time with image documentation, 2D, with or without M-mode recording, complete, with spectral Doppler with color flow Doppler imaging. Codes 93303, 93307, and 93,308 refer to specific types of echocardiograms, such as transesophageal or stress echo, or limited studies. Always ensure the documentation supports all components of a complete study before selecting the corresponding code. Question 20. A patient presents to the urgent care with a laceration on the left forearm, measuring 4-5 cm. The physician performs a simple repair. What CPT code should be reported? I. 12,001. B. 12,002. C. 12,031. D. 12,032. Answer B. 12,002. This question evaluates your understanding of CPT coding for simple wound repairs, emphasizing anatomical location and length. The keywords laceration, left forearm, 4-5 cm, and simple repair are all critical. CPT codes for simple repairs are found in the 12001-12007 range. Specifically, 12002 is for simple repair of superficial wounds of scalp, neck, axilla, external genitalia, trunk, and/or extremities, including external auditory canal, non-hairy anogenital areae, 2-6 cm to 7-5 cm. The forearm is an extremity, and 4-5 cm falls within the 2-6-7-5 cm range. Codes 12031 and 12032 are for intermediate repairs. Always consider the complexity of the repair, simple, intermediate, complex, the anatomical location, and the wound length. Question 21. Which part of the CPT manual contains codes for services such as immunizations, chemotherapy administration, and hydration? I. Evaluation and management. B. Anesthesia. C. Surgery. D. Medicine. Answer D. Medicine. This question tests your foundational knowledge of the structure of the CPT manual. The medicine section, codes 90,281 to 99,607, covers a broad range of non-surgical therapeutic and diagnostic services. Keywords like immunizations, chemotherapy administration, and hydration are all services typically found within this section. Evaluation and management E/M covers office visits and consultations, anesthesia covers anesthesia services, and surgery covers operative procedures. Familiarity with the CPT manual's main sections helps you quickly navigate to the correct code range. Question 22. A patient is diagnosed with a fracture of the shaft of the tibia. Which anatomical directional term best describes the location of this fracture? I. Proximal. B. Distal. C. Diaphysial. D. Epiphyseal. Answer C. Diaphysial. This question assesses your knowledge of basic anatomical terms, particularly those related to bone structure. The keyword shaft of the tibia directly correlates with the diaphysis, which is the long main section of a long bone. Diaphysial refers to this shaft region. Proximal means closer to the point of attachment or trunk, while distal means further away. Epiphyseal refers to the ends of a long bone, typically the growth plates in children. Understanding these terms is crucial for accurately interpreting medical documentation and assigning precise codes, especially for fractures. Question 23. A patient presents with nausea, vomiting, and diarrhea. After examination, the physician determines the patient has acute gastroenteritis due to rotavirus. What ICD-10 CM code S should be assigned? I. A 080. B. A 0 R11 2 R19 7. C. A 09. D. R11 2. Answer I. A 080. This question tests your ability to use combination codes for infectious diseases in ICD-10 CM and apply specific guidelines for symptoms. The keywords acute gastroenteritis and due to rotavirus indicate a specific infectious agent causing the gastroenteritis. Code A080, rotaviral enteritis, is a combination code that fully describes both the cause and the resulting condition. When a definitive diagnosis with an infectious agent is established, you should generally code only the specific infection. The symptoms, nausea, vomiting, diarrhea, are integral to the gastroenteritis and should not be coded separately. Always prioritize specific etiological codes over general symptom codes when a definitive cause is known. Question 24. A patient receives an injection of Depo-Provera, medroxyprogesterone acetate, 150 mg for contraception. Which HCPCS Level 2 code and appropriate quantity should be reported? I. J1050 1 unit. B. J1050 150 units. C. J1051 1 unit. D. J1051 150 units. Answer I. J1050 1 unit. This question assesses your ability to correctly apply HCPCS Level 2 J codes for drug administration, including understanding dosage units. The drug is Depo-Provera, medroxyprogesterone acetate, 150 mg. Looking up medroxyprogesterone acetate in the HCPCS Level 2 index leads to J1050, which is injection medroxyprogesterone acetate, 1 mg. Therefore, 150 mg would seem to translate to 150 units. However, for Depo-Provera, the standard prefilled syringe is 150 mg, and HCPCS often defines units in terms of the usual single-dose vial or common packaging. The key clue is often the drug's typical presentation or how it's billed for that specific drug. In the case of Depo-Provera, a 150 mg injection is commonly billed as 1 unit of J1050, as it's the standard single dose. It's crucial to consult the drug's specific HCPCS guidelines or payer policies when dosage units appear ambiguous. Question 25. Which of the following is considered a covered entity under HIPAA? I. A patient's family member. B. A healthcare provider who electronically transmits health information in connection with certain transactions. C. A medical device manufacturer. D. An employer that offers health benefits to its employees. Answer B. A healthcare provider who electronically transmits health information in connection with certain transactions. This question tests your understanding of the Health Insurance Portability and Accountability Act, HIPAA, and its definition of a covered entity. HIPAA designates 3 main types of covered entities: health plans, healthcare clearinghouses, and healthcare providers who transmit health information electronically in connection with transactions for which HHS has adopted standards. The crucial part here is electronically transmits health information. A healthcare provider, regardless of size, becomes a covered entity if they engage in these electronic transactions. Other options listed do not fit the direct definition of a covered entity. Question 26. A 7-year-old child presents to the pediatrician for evaluation of a rash on his chest. The physician performs a problem-focused history, an expanded problem-focused examination, and medical decision-making of low complexity. Which CPT code should be reported? I. 99,202. B. 99,203. C. 99,213. D. 99,212. Answer C. 99,213. This question tests your ability to select the correct E/M code for an established patient based on the documented components. The patient is a 7-year-old child who is presumably an established patient at a pediatrician's office. The components are problem-focused history, expanded problem-focused examination, and medical decision-making of low complexity. For established patient office visits, 99212-99215. Under the 2021 E/M guidelines, you can choose the code based on either the level of medical decision-making, MDM, or total time spent. With low complexity MDM, 99213 is the appropriate choice. Codes 99202 and 99203 are for new patients. Question 27. What is the correct modifier to report when a surgical procedure is discontinued prior to the administration of anesthesia? I. Modifier 52. B. Modifier 53. C. Modifier 73. D. Modifier 74. Answer C. Modifier 73. This question assesses your specific knowledge of modifiers used for discontinued procedures in facility settings. The keyword, discontinued prior to the administration of anesthesia, is the critical element. Modifier 73 is specifically defined as discontinued outpatient hospital/ambulatory surgery center, ASCI, procedure prior to the administration of anesthesia. This modifier is used by the facility to indicate that the procedure was stopped before the patient received anesthesia. Modifier 53 is used by the physician for discontinued procedures, and modifier 52 indicates reduced services. Modifier 74 applies if the procedure was discontinued after anesthesia administration. Question 28. A patient is diagnosed with glaucoma due to a steroid medication. Which ICD-10 CM codes should be assigned? I. H40-009, T38-0X5A. B. H40-31X0, T38-0X5A. C. H40-009, H40-45X0, T38-0X5A. D. H40-009. Answer B. H40-31X0, T38-0X5A. This question tests your ability to code adverse effects of drugs and their resulting conditions using ICD-10. The keywords glaucoma, due to a steroid medication, indicate an adverse effect. First, identify the type of glaucoma caused by the drug. H40-31X0 represents glaucoma secondary to drug, unilateral, unspecified type, stage unspecified. Second, you must also code the adverse effect of the drug itself. T38-0X5A, adverse effect of glucocorticoids and synthetic analogs, initial encounter, describes the adverse effect of the steroid. Always remember that for adverse effects, you typically code both the nature of the adverse effect, FG, glaucoma, and the adverse effect of the drug itself, with the adverse effect code being the secondary diagnosis. Question 29. Which organization develops and maintains the CPT code set? I. World Health Organization, WHO. B. American Medical Association, AMA. C. Centers for Medicare and Medicaid Services, CMS. D. American Health Information Management Association, AHIMA. Answer B. American Medical Association, AMA. This question tests your fundamental knowledge of the organizations responsible for developing and maintaining coding sets. The CPT current procedural terminology code set is exclusively developed, copyrighted, and maintained by the American Medical Association, AMA, while organizations like CMS, Centers for Medicare and Medicaid Services, adopt and implement CPT for federal programs, and WHO, World Health Organization, maintains ICD codes. The AMA is the definitive source for CPT. Knowing the originators of these code sets is essential for understanding their guidelines and updates. Question 30. A physician excises a malignant melanoma from a patient's back. The lesion size is 1/8 cm, and the margins are 0.5 cm on all sides. What CPT code should be reported for the excision? I. 11,402. B. 11,602. C. 11,603. D. 11,604. Answer B. 11,602. This question evaluates your understanding of CPT coding for malignant lesion excisions, emphasizing site and excise diameter. The keywords malignant melanoma, back, lesion size is 1/8 cm, and margins are 0.5 cm on all sides are crucial. For malignant excisions, the code is selected based on the anatomical site and the excised diameter, which includes both the lesion and the narrowest margins. Here, the lesion is 1/8 cm and each margin is 0.5 cm, so the total excised diameter is 1/8 plus 0.5 plus 0.5 equals 2/8 cm. For the trunk back, CPT code 11602 is for excision, malignant lesion, trunk, arms, or legs. Excised diameter 1 to 30 cm. Code 11402 is for benign lesions. Question 31. What is the medical term for pain in a nerve? A. Neuritis. B. Neuralgia. C. Neuropathy. D. Myalgia. Answer B. Neuralgia. This question tests your foundational medical terminology, specifically suffixes related to pain. The term neuralgia combines nerve with algia, pain, directly translating to nerve pain. Neuritis means inflammation of a nerve. Neuropathy is a general term for any disease of the nerves. Myalgia means muscle pain. Understanding common prefixes and suffixes is a powerful tool for deciphering medical terms on the fly. Question 32. A patient undergoes an incisional biopsy of a muscle in the upper arm. What CPT code should be reported? A. 20,200. B. 20,205. C. 20,206. D. 20,550. Answer I. 20,200. This question tests your knowledge of CPT codes for muscle biopsies. The keywords incisional biopsy and muscle in the upper arm clearly indicate the procedure. CPT code 20200 is specifically for an incisional muscle biopsy. Code 20205 is for a muscle biopsy that requires imaging guidance, and 20206 is for a needle biopsy of muscle. Code 20550 is for trigger point injections. It is important to distinguish between incisional, open, and needle, percutaneous biopsies, as well as the need for imaging guidance. Question 33. According to ICD-10-CM guidelines, what is the correct sequencing when a patient is admitted for chemotherapy for a malignancy? A. The malignancy is coded first, followed by the encounter for chemotherapy. B. The encounter for chemotherapy, Z5111, is coded first, followed by the malignancy. C. The encounter for chemotherapy, Z5111, is coded first, followed by any adverse effects. D. The principal diagnosis is unspecified neoplasm, followed by the chemotherapy encounter. Answer B. The encounter for chemotherapy, Z5111, is coded first, followed by the malignancy. This question tests your knowledge of specific ICD-10-CM sequencing guidelines, particularly for encounters involving chemotherapy. According to Chapter 21, Section 1C21C5A of the ICD-10-CM official guidelines for coding and reporting, when a patient is admitted solely for the purpose of receiving chemotherapy, radiation, or immunotherapy, the appropriate Z code for the encounter, e.g., Z5111 for encounter for antineoplastic chemotherapy, is sequenced as the principal diagnosis. The malignancy itself is then sequenced as a secondary diagnosis. This guideline ensures that the primary reason for the patient's admission is accurately reflected. Question 34. What is the standard claim form used to submit physician and supplier services to Medicare? A. UB 04. B. CMS 1500. C. CMS 1450. D. CPT 4. Answer B. CMS 1500. This question assesses your knowledge of common medical billing forms. The keyword physician and supplier services is the key indicator. The CMS 1500 is the universal claim form used by non-institutional providers like physicians, independent laboratories, and suppliers to bill Medicare, Medicaid, and private insurance companies for professional services. The UB04 or CMS 1450 is used by institutional providers, like hospitals, for facility charges. CPT-4 refers to the CPT coding system itself, not a claim form. Understanding the correct claim form for different types of services is fundamental to medical billing. Question 35. A pathologist examines a prostate biopsy specimen. The report describes 3 separate tissue blocks with benign prostatic hyperplasia identified in 2 blocks and adenocarcinoma in the 3rd block. What is the CPT code for the surgical pathology service? I. 88305. B. 88307. C. 88309. D. 88305x3. Answer: I. 88305. This question tests your understanding of CPT coding for surgical pathology, specifically how to handle multiple specimens from the same organ. The keywords prostate biopsy specimen and 3 separate tissue blocks, but all originating from the prostate, indicate that this is a single, complex examination of one organ. Surgical pathology codes 88300-88309 are typically assigned based on the specimen source and complexity, not necessarily the number of blocks or slides. A prostate biopsy is usually reported with code 88305, Level 4 surgical pathology, gross and microscopic examination, as it falls into the category of biopsies requiring a higher level of examination. You do not code per block, as the primary procedure is the examination of the specimen. When multiple biopsies are taken from the same organ at the same session, they are generally considered one specimen for CPT coding purposes, coded at the highest level of complexity found.